Welcome back to the Eco Interview series, when we are discovering together how new technologies and digital communication are reshaping health communication. So today, I'm joined by Dr. Richard Raycord, who is a former graduate of our program here at the University of Kentucky, and now is a full professor at San Diego State University and associate director of the Thirdhand Smoke Resource Center. Did I say it correctly?
Yes, yeah, great.
Wonderful. So thank you for being here. It's a
Thanks so much for inviting me.
So, Thirdhand smoke, what is that exactly, and how did you come interested in this topic?
That is such a good question. You'll be happy to know that most people have absolutely no idea what thirdhand smoke is. So most of us have been in a room where no one's smoking, but you can smell that stale tobacco odor, and you're like, oh, somebody smoked in here before. Or maybe you can see the yellow discoloration on the walls, and you're like, oh, somebody had smoked in this space. That is thirdhand smoke. So even though we don't, most of us don't put the label thirdhand smoke, we have all had that experience where you can smell that stale odor or see the discoloration. And thirdhand smoke is actually the toxic chemical residue that is left behind in spaces after people stop smoking. And it turns out that nicotine, in addition to being an addictive and carcinogenic compound, is also very, very sticky. And nicotine embeds itself in these reservoirs that get into drywall and fabrics and carpets. And the reason that when you move into a new apartment and you're like, oh, I'll just paint the walls and the smell will go away, but the smell comes back. Or you're like, I'll just get the carpet shampooed, but the smell comes back. It's that stickiness of the nicotine, and those reservoirs are actually incredibly difficult to remove entirely.
It sounds like it's really annoying, like to have that smell in the space where we live, but is it also dangerous from a health perspective?
Yes, so it is more than annoying. Thirdhand smoke is another form of tobacco exposure, and we know from the Surgeon General that there is no safe level of exposure to tobacco. Whether you're smoking the cigarette, exposed to secondhand smoke, or in a space that's polluted with thirdhand smoke, you are still being exposed to those cancer-causing compounds that are in the tobacco smoke. And actually, 26 of the chemicals in thirdhand smoke are listed in California as being either cancer-causing or harmful to reproductive cellular function in the body. And so there's a lot of health risks that come to being exposed to thirdhand smoke. And we can be exposed in different ways than just secondhand smoke. So with secondhand smoke, we think about breathing those chemicals in. You can breathe in thirdhand smoke, but you can also get it exposed on your skin. So you may have noticed, if you know someone who smokes cigarettes, their nails might turn yellow, or they might have yellow stains on their hands. It's because nicotine can stick to our hands. So if you're in a space that has maybe a blanket that has been exposed to thirdhand smoke, and you pick up that blanket, that residue can get on your hands as well, and it can absorb through your skin. You can also ingest thirdhand smoke. So I know that, what is it called, those open concept kitchens that have like the shelves in them, thirdhand smoke really loves to live in dust. And so if you have a home that has been polluted with thirdhand smoke, and maybe you have open shelving, then you could have that dust that might settle in like the bowls or the plates, and then you can actually ingest thirdhand smoke. And thirdhand smoke ingestion is actually the biggest risk for children, because children spend a lot of time on the ground, they put toys in their mouths, they put other things in their mouths they probably shouldn't be putting in as well. Yeah, and so they can in particular ingest thirdhand smoke. And so you can be exposed to thirdhand smoke in ways more than just inhaling like you would with secondhand smoke.
That's so fascinating. And scary too.
Yeah.
So, what are the challenges of communicating about thirdhand smoke compared to secondhand smoke or smoking in general?
Yeah, there's a lot of challenges, and I think the biggest one is that people are really tired of talking about tobacco, right? We have been educating the public about the harms of tobacco use and exposure for decades. And we spent all this time and energy communicating about the harms of smoking. And then we transitioned to communicating about the harms of secondhand smoke. And I think a lot of people sort of emotionally, maybe mentally, thought that was it, right? If I'm not exposed to secondhand smoke and if I'm not smoking, then I'm safe. from tobacco risks. And the truth is, with all of the science and everything we're learning about thirdhand smoke, it's sort of like that expression, the bad penny, right? Like tobacco just keeps coming back. And so here we are again, decades later, and there's another form of exposure that even if you're a non-smoker, you could be exposed to. And so we are talking about this still, and I think people are a little burned out. I think there's also a lot of really crazy, dangerous things going on in the world. I think there are a lot of health risks that we're learning about. And so thirdhand smoke can also feel like I have more things to worry about. There are things that are more dangerous, which is a really big challenge with communicating about the health risks. A lot of people are like, I'm sure it's fine. I'm sure it's not that bad. And one of the challenges that we have is reminding people that tobacco exposure is a choice, right? We can't control environmental air pollution when we're sitting in traffic or there's smog from, vehicle exhaust. There's a lot of environmental pollutants that are just out of our control. But tobacco is in our control, and we can make a choice to keep our homes smoke-free. We can make a choice to try to remediate thirdhand smoke pollution. And it's not as big of a lift as some other health choices, right? So if we want to eat healthier, it can be really daunting, right, to order a salad every day, to eat healthy every meal. But to choose to not be exposed to tobacco smoke is actually a much easier choice. And so sometimes reminding people that yes, it's still tobacco, yes, it's still behavior things we need you to do, but in some ways it's not as big of a prevention ask as some of these other behaviors. And so sort of navigating that dance, like take it seriously, but it's not a lot of big things you have to do necessarily if you're a non-smoker, at least.
I mean, that's great and very encouraging.
Yeah.
That it feels like, okay, yes, we can do this. It's actually doable. So you've used social media platforms, I think about Facebook, for example, for distributing many of the messages that you created to communicate about this topic. Why is social media a good or necessary space to communicate about this issue in particular?
Yeah, social media is a wonderful place to communicate with the general public about health-related topics because most people are somewhere on some platform on social media, right? A lot of the communication messaging that we did was very geographic and regional, right, and before social media platforms came along. And social media really breaks down some of those geographic constraints that can be set around broadcasting or journalism. And so social media is a way to reach a lot of people at once that all have the same things that they could be worried about because tobacco smoke doesn't really care, which state you're in or which, broadcasting, geography you're allowed to go to. So social media has been a way to reach a lot more people all at the same time. And social media is an enticing platform. There's the visual aids that can be more appealing than a lot of the other sorts of traditional media platforms and even podcasting, right? Like I'm sure watching you and I is very interesting, but scrolling through social media pages and seeing some of the images and graphics, it's a great place to create visual translations of some of the more complex science. And tobacco can have a lot of complexities to it, right? A lot of people talk about, another challenge with tobacco in general is that we don't often see the consequences for decades, right? And so translating how we know the risk is there and making it real now when you may not have to navigate those consequences for 20, 30 years can be hard. And so social media is a nice way to make these visual images and posts that can help us reach and resonate with different audiences.
Where they are.
Yeah.
Yes. And so part of these messages are also formatting formal narratives. And if I remember correctly, you focus in particular on narratives from parents' perspective. So why is this an effective strategy? What did you discover in your research?
Yeah, so two, I think, answers to that. The first is that stories have historically always been a powerful persuasive tool, right? And that's true for any health context. sex, and tobacco is no exception. Most of these stories that we pull at the Thirdhand Smoke Resource Center actually come to us from people. We have an email address. It's contact@thirdhandsmoke.org if anybody has questions or wants to reach out. But people send us in their stories about smoke intrusion or smelling the odor or seeing the stains, or we get lots of questions about children. I have children, I have an in-law or a family member that smokes. Is it safe for them to wear those clothes that they were smoking in and hold my child? And so parents are trying to navigate a lot of different, things to help keep their children safe, and tobacco prevention is another one of those examples. So first part, narratives are always really powerful. Children have always been the most persuasive component of tobacco prevention messaging. So, when there was all this campaigns and research that was trying to educate people about how much it would harm their own health if they smoked, a lot of people stopped, right? But when the research really started pointing out to secondhand smoke would harm the people you love, and secondhand smoke would be dangerous to children, that's when you really see the smoking rate dropped, right? So children have always been who we care to protect as a society, and thirdhand smoke is a risk. They are probably the most at risk for thirdhand smoke exposure. And so it's important to remind people about the choices they make, who they're putting at risk when they make those choices.
That's so important. You also look at how algorithms can influence this campaign, which I found really interesting because we put so much efforts in creating these messages, but sometimes I have the feeling that they're not always in our control. So what does your research say about that?
Yeah, I'm glad you asked about that because I think I too was sort of, we put a lot of work in campaigns and in these efforts to disseminate, and as social media has come along, it's become more reliant on algorithms, which is, great when you want a curated news feed, right? But when you're the content creator and you're trying to reach people really generally and broadly, how do you get into their algorithms? How do you leverage the algorithm in a way that would trigger it to share your post, right? And also, even in answering this question, I make it sound like the algorithm is some decision maker. And the algorithm is sort of like coding that exists that's controlled elsewhere that we're just sort of at the mercy of. And so I was really interested, particularly in our second social media campaign, where we use narrative storytelling for parents and children, about how the algorithm had impacted those messages. Because prior to that campaign, our first one, the algorithm wasn't quite as pervasive as it is now. The meta platforms didn't let the algorithm do quite as much curating as we see now, right? And so when the second campaign came out, I was very curious, what is the algorithm picking? What is the algorithm deciding that people want? And we found that narratives still emerged, right? That the really specific and detailed narrative stories that we were highlighting, the algorithm was able to tap into that being pushed to audiences, which is good, right? We can see storytelling still coming through even on these platforms. But it was weird as the campaign creator to not be in control of where my messages went and who saw my messages. And so understanding the algorithm, I think for me was sort of an act of curiosity of okay, are you helping me or hurting me? How are you impacting the success of this? Because so much of campaign evaluation is who saw it, how effective was it, where did it reach? But I couldn't make those choices because the algorithm was doing it for me. And so that's where that sort of side project of that came from.
And I think it's so important for the evaluation to have an answer or at least an understanding of how this dynamic works. And related to the evaluation, so I saw there is a disconnect in some of the engagement metrics that we typically look at when we create health campaigns on social media, and then the actual behavior resulting. So how is this playing out in your work?
That's been really challenging, I think, in the social media campaign era, is being able to gather real-time behavioral data from people who see the messages, right? I can gather data from people very easily in surveys, but the people who see my message, I don't know who they are, right? I can't even predict who they are. We tried that in the first campaign, actually, and we tried to play the algorithm where we recruited from the platform, knowing that the people we recruited would click the recruitment link, and therefore the algorithm would have flagged them as being interested in our content because they fully clicked and filled out this link, and then we were able to target those individuals. But when the second campaign came around a couple years later, that became even trickier, right? And so in understanding when people see the message, how is that changing their behavior in the real world, right? I can do that in a controlled experiment, I can do that in a survey, but when people are scrolling on their feeds and they're seeing our messages over and over again, it's harder now to capture whether or not they're acting on those requests. I know whether or not they're liking it. I know whether or not they're commenting. I know that it showed up in their feed, but I don't know if they are preventing people from not smoking in their homes. I don't know if they're not letting people smoke in their cars. I don't know if they're starting to engage in those behaviors. So I think because of some of those challenges, it's made pre-testing a lot more important, right? So I actually just launched a campaign this month. It's my first YouTube campaign.
By the way.
Thank you. Yes, it's a video-based campaign, which was also my first time doing videos, my first time doing a not meta social media platform, which was wild. But we did a lot more message pre-testing, message evaluation. We did a lot more establishing that exposure is associated with behavioral outcomes, so that when the message went out there, I already had the evidence that the campaign should be effective out in the real world. And then I've got all this reach data and engagement data that's supplementing and sort of supporting that these messages are being well received. And so it's a little bit of sort of the reverse, where I've been establishing those outcomes first, and then I run the campaign.
That's so important, because it can also help you adjust messages in case.
Yeah, funny enough, I'm presenting tomorrow on some of the pre-testing of the campaign, and I've never had so many phases of campaign review. I tried to put it all on a slide, and I was able to sort of group them into 6, but the 6 phases still had all of these sort of steps and processes, and I really spent a lot more time in that getting feedback than I had in any other campaign, because we really weren't going to have it on the other end.
There is so much work that goes into preparing a campaign, studying the campaign. Sometimes we take for granted some of the messages that we say online.
Yeah.
They seem small and nice, but in reality they require so much work. So I think it's important to acknowledge that. Another very important aspect of communicating on social media is the role of communities. Mm-hmm. And you do work to communicate about Thirdhand smoke, but I also know that recently you look at e-juice mixing, which was something I was not really even thinking about.
Yeah.
And you were mentioning that this is a different kind of behavior, because when we talk about Thirdhand smoke, we are teaching something. But when we look at the e-juice mixing, and people are learning something that we would like they not to. So how do you make sense of this double role that social media can have, and communities on social media can have in talking about health issues?
Yeah, it's so interesting, right? I mean, everything is force for good, force for evil, right? So I try to create messages that I hope for good, but then those same platforms can be used to promote things that sometimes make me go, why are you allowed to post that or share that? So if your viewers don't know, e-juice is the liquid in vape devices, right? And so actually a few years ago, I had a grad student who ended up getting his PhD with you all, the now Dr. Groznik, mm-hmm. who actually came to me. He was on a Reddit thread, and he said, did you know that DIY e-juice is a trending thing? And I was like, well, I know what DIY is. I know what e-juice is. Are you telling me that people are basically playing amateur chemist in mixing these chemicals? And he said, yes, that's what people that's what I'm telling you. And so immediately we were we have to do a study. We partnered with a professor in biology to sort of look at some of the various different chemical aspects of this. And we were talking to people about, how did you learn about doing these behaviors on your own and the perceived risks. And these online platforms were the primary spaces where people are learning and exploring and trying to engage. And, we think about it, we talk about that a lot with recipes and healthy eating or exercise tips, but we do see it with some more unhealthy behaviors as well. Quite a few years ago, actually, I did a project with a group of grad students, and we looked at Reddit. And we found that we were looking at how trustworthy people find Reddit. And what we found is regardless of how the users sort of viewed the accounts, they were basically willing to try anything a Reddit user posted. So if they didn't know who the poster was, if they weren't sure about their background, just this online space gave them enough curiosity that they had a high willingness to try almost anything, which is really scary, especially if you have kids mixing chemicals, right? And so you've got these sort of riskier behaviors that people may not even realize are happening on some of these communities. So I think as researchers, it's important for us to know they're happening, right? And it's also important for us to be in those platforms, which is a lot of what that Reddit study was trying to do. We actually started trying to engage on the platform. We tried to post our own content. We looked at how people responded to our own posts. It was an experimental design, so funny enough, the Reddit users actually caught us really fast because we had the same messages posted on a few different threads, and they were like, oh, this is sus. I don't know if they were using that word then, but they basically were like, you've got these same people, this is a troll. And we were actually just using these different, sort of trying to have some power, right, to look at how these different messages played out across these different subreddits. So it was really fascinating to be part of that community, to see how people responded to those types of messages. And I think it's important for us to be there as experts and to be in those spaces to try to maybe help provide some advice. And then, of course, my work really studies how those spaces impact their behavior and their decision making. And as you mentioned earlier, I do a lot of work trying to educate parents, because it is important for parents to know that some of these behaviors that maybe aren't getting a lot of attention at a national or federal level are still really important, even if they're not elevating to these larger conversations. They can still be very risky for kids.
No, I think it's very important, and knowing that we can learn these things from spaces like Reddit, and it's so easy to access, and a lot of our youth are accessing that. It's so important because it helps us actually prevent something from happening, but also monitor and act as soon as possible when things like this happen. So what do you envision in this area of work for the future years? So where would you like our field move forward in third-hand smoking prevention, campaign designs, and yes, so what do you think?
Yeah, well, I would love third-hand smoke to become a household phrase. That would absolutely make my day. Actually, at the conference we're going through now that I got my little badge on for, I am not the only third-hand smoke panel at the conference. There's a second third-hand smoke paper, and I about fell over because there's a lot of third-hand smoke research in biology and chemistry, and even some in public health. But communication, I haven't seen other third-hand smoke studies that often.
One of the first, actually, to work on this in communication.
I was definitely one of the earlier scholars, and I've typically only always been the only third-hand smoke presenter. So I was so excited to see somebody else doing this work. And so I hope that not only has third-hand smoke become this household name, I hope it becomes something that lots of disciplines are examining and looking and studying, because tobacco has always been a challenge that transcends disciplines. It is a true interdisciplinary problem that we need all sorts of researchers examining and studying. There's no benefit that tobacco has ever given society other than making a handful of people really, really rich, right? And so it doesn't. I would love to live in a world where you can't buy any tobacco products, that tobacco isn't available for sale in any form. So that would be a dream. Even if that were to happen today, though, if tobacco was removed from the shelves, there is this legacy of third-hand smoke that's been left behind, and we are going to have to navigate who's responsible, right? The tobacco industry knew that this residue was being left in these spaces. I think it was in the 1960s. This was not a secret that the spaces would be polluted. But we didn't even really start talking about it till the early 2000s, right? And so we are going to have to grapple with who pays for these remediations. It's expensive. If you truly want to remove, the reason that you can't just paint over the walls, that you can't just clean the carpets, is because those reservoirs are so difficult to remove that the recommendation is actually to replace all your drywall, to replace your carpet, to replace your HVAC system. Who's going to pay for that? In my mind, the tobacco industry should pay for that. They knew this was happening. They didn't warn the public, and this is an issue that they should be responsible for cleaning up. And so I hope Thirdhand Smoke becomes a household name. I hope that tobacco is that no one else wants to buy it, and it's not for sale anymore. And I hope the tobacco industry is held responsible for polluting all of these spaces that we didn't voluntarily want polluted, right?
So I think there is also a lot of work that needs to be done policy level to start having this conversation.
Yes. Absolutely, and we're getting there. Actually, California just passed AB 455, which is, as far as we're aware, is the first legislative bill of any kind that has actually defined third-hand smoke as a term. And in California, as of January 26, it's actually required for home sellers to disclose third-hand smoke pollution in their home. So this is a way to help home buyers be more aware, because we see a lot where you know, that buyer beware, where people were buying homes that were polluted with third-hand smoke, but there's no accountability for who's supposed to clean that. If it wasn't reported, it wasn't necessarily always deemed as, you know, what is the legal words, the like intentional misdisclosure, right? But so now if there's any known history of third-hand smoke in these spaces, it does have to be disclosed. And California is also updating its environmental hazards book so that there are resources and information about third-hand smoke in the state. And so we are hopeful that other states might replicate what California is doing with third-hand smoke, and we would love to see, you know, other countries start doing this as well. We get a lot of jokes, a lot of trolls online that are like, oh, third-hand smoke, it's going to be fourth-hand smoke. There's no fourth-hand smoke, we're done. Third-hand smoke is the end of it. If we can get rid of that pollution and get rid of that residue and really live in a world free of these tobacco toxins, that would be my ideal vision. And I think social media is a way to help people understand why that's important, and to maybe even think of a world like that themselves. So
that would be beautiful. And on this note, I actually would like to ask our friends at home, did you know about third-hand smoke? And how are you planning to make some changes in your life related to this topic after this conversation? Let us know. We would like to hear from you in the comments section. Thank you so much, Rachel, for taking the time to navigate us through this research. And thank you so much, everyone at home, for paying attention and being here with us. Stay tuned for the next conversation.